Hi, and welcome to Prenatal Massage Techniques. My name is Jennifer, and I will be going over some techniques for you to help you with your massage practice. So I threw in a few pictures here of some clients of mine in various stages of their pregnancy, just mainly so that you could see how I position them throughout, whether it's in a sideline position or in a prone or supine position. And as long as they're comfortable, we can accommodate. Now, these are some bolsters. They're the body cushion bolsters that I like to use. You don't have to use them, but I do find them very, very beneficial. And if you can, I highly recommend it. They are very much worth the investment. This is how I set them up. So I've got wedges in there to help open up the space for the baby so that you can accommodate her as she grows. Here we have Tamara in the prone position. She's about 32, 33 weeks here. But we have her on top of those bolsters. There's enough space for her belly, but she's still feeling cradled and supported and not like her low back is feeling that extra pressure. Here we have her in a sideline position. So as you can see, her shoulder is supported by the cushions. Her belly and her hips are supported so that she can feel completely comfortable while in this position, as well as we have her knee supported so it's not putting too much pressure on her. And now we have the lovely Doris. We are doing a massage on her. Now the smiley face is because I had this really weird, terrible expression on my face, so I changed it. Okay, so I want to make sure that it's very important that we drape well and that we delineate where we are working so that the client knows what you're doing. Obviously, we're going to discuss that with them, but it's also nice to have that physical barrier so that they know what is going to be worked on and where you're not going to go. So I'm just starting by applying the lotion and or oil, whatever you choose to use. I personally like to use a lotion, but I know lots of people like the gel or an oil. But yeah, we're just applying that to get things started. One thing I would recommend when doing prenatal massage is work slowly. The slower you go, the more relaxing it is for them. Even when they are sore, you can work on those areas, but they're still very relaxed because it's a nice, slow movement. So as you can see here, I'm just using my thumbs to work in those lamina grooves, work on the QL a little bit from the side there, and then find that I'm working all the way up that spinal groove to get those multifidus and all those muscles that reach in there in that groove there. Now, you may have noticed that the speed is a little bit fast. I've just sped it up so that it's a shorter video for you. But the speed, I do recommend moving slowly so that you can really allow the client to relax. Now here I'm just doing some compression, placing my wrist or my hand on their sacrum and just gently pushing downwards. So not against them into their sacrum, but just down so that you're stretching out their vertebrae. So we have her leg draped now to work on. We're going to demonstrate working on the hips and legs. As you can see, I have a towel there. It's a little extra piece of security for the client, especially if you have thinner sheets. And by thinner, I mean not as wide, because sometimes they don't always cover everything. So this just makes sure that she's covered, nothing's exposed. It's more for the client than it is for anything. So as you can see here, I'm just doing some long strokes over the greater trochanter. You can do C cupping here. As you can see here, I'm sort of moving up and squishing the legs together using my thumbs. I'll show you another angle from the front as well, so that you can see all the movements. Now, one thing I wanted to just go over is the difference between deep tissue and deep pressure. A lot of people will say you can't do deep tissue or deep work on prenatal clients, and that is true. However, they still want pressure. So make sure that if a client wants deeper pressure, that you can accommodate that. It doesn't, you're not necessarily doing deep tissue work. And by deep tissue, I mean working on the areas that are deep underneath the surface muscles. So by deep tissue techniques or deep working on the deeper tissues, we are not going to be doing things like cross fiber friction or the PNF stretches or really sort of working the ligaments because they're already loose and we don't want to make things worse, right? We're just simply relaxing the muscles. And some people prefer to have deeper pressure, but that doesn't mean deep tissue. So that's just something to be aware of when you're working on a client. That you can have deeper pressure. It does not have to be super light, feathering, petting. It does not have to be a light massage. It just needs to be to their comfort level, but slow. Like if you're working slow, that's perfect. If you're concerned about DVTs or blood clots, then work in shorter strokes. So do more side to side strokes. Use your thumbs more as opposed to broad effleurage strokes, but just work slowly. And just know one thing to note is a client may normally like a really deep pressure massage, but likely they're going to feel their skin is going to feel more sensitive. And that's just because of everything that's going on. The body's doing a lot right now. So their skin might feel more sensitive and you may not even be able to go as deep as they think they want you to go. So just make sure that you're always checking in with them so that you can, if you need to ease up, then you ease up. That if you're not good at easing up and staying consistent with that, that's something I strongly recommend practicing. Keeping at a consistent pressure. So now I'm just showing you some techniques for the abdomen. Not every pregnant woman is going to want this. So you have to always ask, never assume, because the stomach is a very intimate place and people can be very, very self-conscious about their stomach. So we're just making sure that she's properly draped, nothing is exposed, she's tucked in, she's feeling comfortable. Excuse me. And then we're just applying the lotion in a clockwise way. And as you can see, I'm lifting her up from her spine. So I'm reaching down and grabbing her muscle from the spine and just slowly dragging and wiggling it up as I let go. That feels amazing. Clients love it. You can also try doing it from one position or one side or the other. Here I'm doing it from the other side. It's similar to the technique you would use to work on the QL, but we're not necessarily going to be working on those QLs because it can aggravate the baby if they're far enough along. They sort of get agitated. So you're just going to lift from the spine and gently pull up towards the center. So now we're going to work on the hands. One thing I find that clients like to hold your hands when you're giving them a massage or working on their arms, and that can be a little uncomfortable. It is for me anyway. So I've developed this sort of way of draping the arm and holding onto the arm, controlling the client in a way that um, doesn't allow them to want to like hold my hand. So as you can see, following my draping techniques of always having a blanket sort of give it that physical barrier, make sure that we're moving her arm and we're tucking her in so that she is fully comfortable and not exposed. There's no air drafts and she feels secure in what you're doing. So as you can see, I hold the hand or hold the elbow with one hand and then gently lay the her hand on my forearm. And that allows me to work on the area, lets her relax, and just creates a barrier so that she doesn't think she needs to hold my hand. You can work on this, with both hands, or you can do one at a time. Um, just sort of whatever works best for you. If you are a smaller person and you're working on a larger person, this technique might not work best because their arms may be way too big to handle. Um, so just make sure that you are the one, like you're in control of the client. So I always hold the wrist, I don't hold the hand. And that lets them know that this is a professional, there's nothing intimate going on here. So I hold the wrist with my one hand and then work on the area with the other hand. And you can do all kinds of techniques here. You can do thumb work, all kinds of techniques, stripping, effleurage, all kinds. And then, as you can see, I'm holding the wrist with my other hand and then tucking her elbow in so that I can work on the inside of the forearm. It, what you don't want to do is bring her arm out and have it flopping straight out because that will put pressure and could cause damage to her elbow by hyperextending it. I'll show you that here in a minute. But yeah, you can just sort of again, you're using your other hand to support the forearms that you can do give put in some pressure. See here, this is where like if you don't do that and you're going to use pressure, you could potentially hyperextend her elbow and then injure her, and that's not comfortable or good for anybody. So you just want to make sure that the elbow is always in contact with the table, or you've got it cradled in your hand. So this next clip is of a client of mine. She is 30 weeks pregnant here. And I just wanted to show you sort of a sped up version of me giving her a sideline massage. Where we're just draping the leg. And as you can see, I have the pillow as well as the little ankle pillow as well to, again, lift her leg up so that it's more straight and putting less pressure on her hips. So again, making sure we're working on that greater trochanter, working those glute muscles, really working the hips because they are doing a lot for her right now. It's shifting, her ligaments are no longer the supporting character. Now the muscles are doing all the work. So we want to make sure that we're working on those muscles so that she can get some relief. But we don't want to overwork ligaments, obviously, because that could damage things in the future. So we're just going to switch her over to the other side. Replace those pillows. And again, just draping the back to work on the back in this position. Now, if you were doing a prone position massage, you can use all your same back techniques that you would on a non-pregnant person. You just want to be careful and, be aware of your pressure. Make sure you're paying attention to how she's feeling. And if she, says things like, I'm starting to feel a little lightheaded or a little nauseous, then you're going to want to change her position. Um, I would say that most of the time that is not a concern, but for some people it is. It depends on where the baby's sitting, how the bolsters or how she's resting in the bolsters. You may need to readjust things, but as a whole, I'd say like 99% of my clients prefer the prone and supine positions. So here we're just doing some sort of C's with our thumbs along the erectors, and then we're going to move into some raking along the intercostal muscles because those guys get really tight and really sore because the baby's making that rib cage expand, right? So, and the further along she gets, the more that rib cage is expanding. So those muscles get really sore and fatigued. So we're just gently raking up those intercostals. You can go up or down. I prefer to go up just because if I go down, then I feel like I'm not being thorough along the erectors. And you can see here that she's doing, or I'm doing, I'm doing some neck work in this position. I don't do a lot in this position. I prefer to do that when she's lying on her back. I just feel I can get a better angle on her neck work. But really, what works for you is what matters. As long as you're paying attention to the client, how she's feeling. You're using slow strokes and you're draping so that she doesn't feel like she's hanging out. I'd also like to mention that when I do sideline massage, and I strongly recommend this for everybody, is to be seated. It is much easier to work in this position on the back than it is to be standing. Your force or direction of force is easier to maintain when you're in a seated position, and therefore it's less painful on you. So now we're just transitioning to the supine position. And I always end in the supine position because I feel like it's the most comfortable, especially if they've been lying on their side or sides for the whole massage. So I put in a wedge so that she can lie and be in a more seated or lounge style position. We take those pillows out from underneath, or you could put them underneath her knees. I prefer to use a different kind of wedge to put under the knees because I just feel it's more supportive. So I'll just show you that. It just puts her knees into a more 90-degree angle. There we go. So then that you take all that pressure off the baby potentially lying on the vein, right? Because that's what we're worried about. We don't want the weight of the baby compressing on that vein and causing the weight of the baby can cause her to feel nauseous or lightheaded, dizzy. She might feel like she's overheating. You just want to make sure that you're paying attention to those signs. And if she is feeling that way, then we need to adjust. So either putting more wedges underneath her knees or lifting her up so that she's in a higher seated position. And don't be afraid to give them a foot massage. They're doing a lot of work. Their feet are their body has changed, their ligaments are all changed, and their feet are getting sore. So yeah, don't be afraid to work on their feet. And that's it, guys. Feel free to give me a call if you have any questions about more techniques or you want a one-on-one. I can go over it more for you.